This common mistake causes heart attacks. Do not do this. Cardiovascular diseases are responsible for approximately 1/3 of deaths worldwide, with heart attacks being one of the most common causes. It is alarming to note that 75% of people who suffer heart attacks have multiple risk factors simultaneously. Therefore, it is crucial to know and combat these risk factors to prevent heart attacks and other serious cardiovascular diseases. Measures such as maintaining a healthy lifestyle, managing stress, undergoing regular checkups, and following medical advice are essential to reduce the risk of these diseases. Recently, attention has been given to stress as a factor influencing numerous chronic diseases in the body. Did you know that it is also one of the main risk factors for heart attacks? By watching this video, you will learn about the relationship between stress and heart attacks and what measures you can take to avoid them. Before we begin, don't forget to subscribe to the channel and activate the notification bell. Almost 90% of people who watch our videos every week forget to subscribe to the channel, thus missing out on our videos with vital health tips and information that can save lives. What is a heart attack or myocardial infarction? A heart attack, also known as a myocardial infarction or heart attack, occurs when blood stops flowing to a part of the heart. This happens when the arteries that carry oxygen-rich blood to the heart, called coronary arteries, become blocked. These blockages are usually caused by the buildup of cholesterol and fats in the walls of these arteries. This process of fat buildup in the arteries can occur throughout the body and develop slowly over time. In some cases, a small blood clot can detach from an area where the plaque is unstable and block blood flow. It is important to know that a heart attack is a medical emergency. If you or someone close to you exhibits symptoms of a heart attack, such as chest pain, shortness of breath, or discomfort in the arm or neck, seek medical help immediately. Symptoms of a myocardial infarction. Interestingly, some heart attacks have no symptoms and are only discovered later through tests such as electrocardiograms or echocardiograms. However, most of the time, there are symptoms that can vary according to the patient's gender and age. Doctors consider cardiovascular risk factors along with symptoms to make a quick diagnosis and start the necessary treatment. The most common symptom is chest pain, usually felt in the center of the chest as pressure or a sensation of weight. This pain can occur suddenly or after physical activity and can spread to the shoulder, left arm, back, neck, or even the upper abdomen. The pain is usually very intense and comes on abruptly. Other symptoms include palpitations or rapid heartbeats, tachycardia, and difficulty breathing due to the heart's failure to pump enough blood to the body. The intense pain can cause difficulty breathing and palpitations. Additionally, there may be intense cold sweat and fatigue and blood pressure caused by heart failure. Low blood pressure and insufficient blood pumped by the heart can cause dizziness, nausea, vomiting, and in more severe cases, loss of consciousness. In some cases, mild and intermittent symptoms may occur before the heart attack. These symptoms appear with a certain level of physical activity and improve upon stopping the activity or resting. This activity-related pain occurs because the demand for oxygen and the increased heart rate cannot be met due to partial interference with blood flow in the coronary arteries. This condition is known as angina and can be a warning sign of a future heart attack. Can stress cause a heart attack? Over the decades, researchers have identified what can increase the risk of heart attack and other cardiovascular diseases. In addition to known causes, emotional stress has been a particular focus because it is difficult to measure in practice. Several studies have been conducted to understand this relationship. An important study published in 2001 analyzed more than 900 patients with coronary artery disease. It was found that under stress, blood flow to the heart muscle was affected, which could be severe enough to cause symptoms or even acute cardiac events. Participants underwent standardized emotional stress tests to measure their impact on the body. Most cases showed that emotional stress directly affects blood flow to the heart, increasing the risk of heart attack. Another study involving more than 24,000 people from 52 countries also concluded that emotional stress doubles the risk of heart attacks, regardless of other risk factors. Therefore, it is essential to consider emotional stress as a serious risk factor for heart disease. How does stress cause a heart attack? Emotional stress can significantly impact heart health and the body in general. There are two types of stress: acute, which is short-term, and chronic, which is long-term. Acute stress causes temporary hormonal, metabolic, and vascular changes in response to a threat or risky situation. These changes are generally beneficial because they are brief. On the other hand, chronic stress has a negative effect, especially on blood vessels and the heart. Chronic stress, caused by work, family, or financial problems, can increase the risk of cardiovascular diseases and other health problems, such as muscle and stomach pain, insomnia, headaches, and fatigue. It particularly affects the cardiovascular system, causing hypertension and decreased blood flow in small blood vessels, including the heart. This type of stress increases cortisol levels, which can lead to metabolic disorders, diabetes, high blood sugar levels, and weight gain. All these factors increase the risk of a heart attack. Furthermore, emotional stress is often associated with sleep problems such as insomnia. Quality sleep is essential for overall health. Insomnia alone can cause vascular changes that increase the risk of metabolic and cardiovascular problems, all associated with a higher risk of cardiac ischemia, which is the reduction of blood flow to the heart. The brain's impact on the heart. Research shows how the brain affects the heart, especially when we are under emotional stress. A part of the brain called the amygdala is responsible for initiating a series of chemical reactions in the body when we face stressful situations. During acute stress, the changes caused by the amygdala are temporary and generally do not have negative health effects. They act as a defense system for the body and disappear shortly after the stressful situation passes. However, if the stress is continuous, the hormonal and neurotransmitter changes generated by the amygdala can cause more serious problems. This includes increased insulin resistance, increased body fat, and other metabolic consequences. Additionally, there may be decreased blood flow due to hypertension and increased vascular tone, which accelerates the buildup of fatty plaques in blood vessels. Therefore, there is a direct connection between the brain and the heart. The stimuli that cause vascular and metabolic changes, increasing the risk of heart attack, come from brain areas responsible for generating these changes when we are stressed. Risk factors that can cause a heart attack. There are several cardiovascular risk factors that increase the chance of someone suffering a heart attack. They can be divided into factors that we can change and others that we cannot. Excessive alcohol consumption. Drinking alcohol excessively is associated with hypertension, fatty liver, and metabolic changes. These factors together increase the risk of heart attack. Diabetes and prediabetes. Both type 1 and type 2 diabetes cause changes in blood vessels throughout the body, including coronary arteries, which increases the risk of a heart attack, especially at younger ages. People with type 2 diabetes have a 2.5 times higher risk of having a heart attack. Sedentary lifestyle. Lack of physical activity is associated with a higher risk of stress, hypertension, obesity, and diabetes, all of which increase the risk of heart attack. Smoking. Smoking releases toxins that can narrow coronary arteries, significantly increasing the risk of heart attack in smokers compared to non-smokers. Even smoking small amounts, such as 1 cigarette a day, can increase the risk of heart attack by 30%. This also applies to those exposed to secondhand smoke. High cholesterol and triglycerides. Elevated levels of cholesterol and triglycerides lead to the buildup of fat in blood vessels, increasing the risk of heart disease. Family history. People with first-degree relatives, such as parents or siblings, who have had heart problems, such as angina or heart attacks, are twice as likely to develop heart attacks. Overweight and obesity. Overweight is directly related to poor eating habits, hypertension, and adverse conditions such as sleep apnea. All these factors together increase the risk of suffering a heart attack. Gender. Men are 2 to 3 times more likely to suffer a heart attack compared to women. However, after menopause, this risk equalizes between men and women. This is because estrogen, a hormone with a protective effect on blood vessels, stops being produced during menopause. Age. The risk of heart attack increases with age. This happens because atherosclerosis, which is the buildup of fatty plaques in arteries, is associated with the aging process. 5 ways to manage stress to avoid a heart attack. Consider trying these steps to help manage stress in a healthy way. Number 1, try meditation. If your stress cannot be managed with general measures or lifestyle changes, consult a professional, whether a psychologist or psychiatrist, who can help with behavioral tools or, as a last resort, some medication that temporarily reduces stress levels until you can manage it solely with your lifestyle habits. Number 2, get enough sleep. Take care of your sleep. Ensure quality sleep and that the time you dedicate to sleep is adequate. During sleep, many important processes occur. Various hormones are released, and tissues are repaired, helping to reduce the effect that chronic stress has on blood vessels and blood flow. Maintaining adequate sleep also improves mood and helps face daily problems with more serenity and focus. Number 3, stay active and move your body. Physical activity is essential to reduce the risk of a heart attack. In addition to avoiding overweight, it improves vascular tone for hypertensive patients and helps control blood pressure. Exercise also has a beneficial effect on stress, thanks to the release of endorphins and improved sleep. Number 4, eat healthily and balanced. Maintain a diet rich in vegetables, fruits, antioxidants, and omega-3, eliminating processed foods rich in sugars and saturated fats. A healthy diet not only directly affects cholesterol and triglyceride levels in the blood, but also blood sugar levels, reducing the possibility of overweight or helping to lose weight in cases of obesity. Myocardial infarction is one of the most common cardiovascular diseases and represents the leading cause of death worldwide. That is why we dedicate this video to focus on each of the most important and hardest to eliminate risk factors for cardiovascular diseases. We hope this video has been helpful. If you have something to add, share it with us in the comments. Don't forget to subscribe to the channel. I'm leaving 2 videos on the screen that I am sure you will like. See you there.